Well, hello everyone and welcome to today's webinar. My name is Dawn Van Dam and I'm the president of Health Connections. I think we have a very exciting tool that we're going to show you today, and I'll give you a bit of background and we'll jump right into our session. So today's talk is, are you launching a new solution to physicians or even other clinicians? And would you like to help patients find those physicians, clinicians, or other healthcare practitioners? So I'm going to give you a little bit of background information and tell you a little bit about what we do here at Health Connections and how it's our mandate to help support your growth and your success in the marketplace. So our fundamental mission is to transform science into commercial success. And we do that in the area of either life sciences, new opportunities, healthcare new opportunities, or consumer health opportunities. We have a very large database of over 5 million people all around the world in all of these three areas, life sciences, healthcare, and consumer health. So we can help you be successful at either launching into the market or growing your brand more than it is today, or reaching new customers all around the world. So as you will shortly be hearing more about, probably in the new year, I'm about to finish launching my book. I'm the author of the upcoming book, Transforming Science into Commercial Success, how to move from cures to cash, or if it's not a cure, just to move to commercialization success. So I'm really looking forward to that in the new year and 2016. But I wanted to talk to you about perhaps where you're sitting today and understand what you might be going through. So we know at Health Connections, based upon some surveys that we've done, that only 0.4% of universities actually teach sales or marketing or commercialization to their scientists or clinicians. So you're kind of starting behind the 8 ball if you have a new science that you're trying to be a first-time entrepreneur, let's say. We also know that 99% of entrepreneurial scientists or healthcare professionals are frustrated with their efforts to date in commercializing their services. So again, we've done lots of surveys, and we've garnered this information from all of you. Not necessarily you who are on the line today, but from other people that we've surveyed. We also know that even if you are an established organization, only 50% of established organizations have a top-level or C-suite marketing person kind of driving forward their success. And we also know that, if I can get to my next slide here. Okay, there. That you are 400% more likely to be successful if you have a coach or a firm to help guide you based upon experience like we have at Health Connections. So we're really looking forward to helping some of you, or perhaps all of you, be successful as you move forward. So we have a number of services that we can help you do that. We have extensive commercialization services. As I mentioned before, we have that global network of contacts and prospects. We have some strong partnerships directly with the industry through our consortia and other things like that. We also provide advisory services around raising capital and help make introductions to potential investors. And we provide strategic coaching and mentoring to all of our clients, whether you're big or small, and we do that free of charge. But I would really like to know today who's online with us. So if you wouldn't mind just going to the right of the screen, you'll see a chat box. And you'll probably see where it says all participants. Just click on the little arrow to the right of all participants, find my name, Dawn Van Dam, and send me a message and tell me, if you can, where you're located, where you're calling in from, and your title. I won't ask you to tell me your company name because perhaps some of you want to remain anonymous, but if you could tell me where you're calling in from and you know, your country or your city or something like that, and what your title is, that would be great. Just like to recognize your participation today. So I see people from the United Kingdom, a clinical services director, from Canada in business development, the US in Florida, in Mississippi, in Canada again from Markham, Ontario, in the United States from Florida again in Deerfield, the other one was Coral Springs, Germany, Finland, another from Canada, India, Chennai, India, the United States, Canada, Brampton, Ontario, Portugal, Tunisia, Atlanta, Georgia in the United States, a couple more from the United States, Pakistan, Lahore in Pakistan, another from Georgia in the United States. So just want to make sure everyone can use that chat box. Oh, here got a few more. We have German Cancer Research Center, Helsinki, Finland, business development calling in from Kitchener, Canada, Vicky from South Florida, admin for a urology practice, Portugal, someone in the Netherlands but based now in Munich for a month, a scientist by training but transitioned to a business analyst during my master's degree. Great, thank you for all that information, that's fabulous. Great to know that you're online today, and I'm looking forward to bringing you lots of great information. Another person launching a new medical device for urology. So lots of great people from around the world. So thinking about what your goals are and why you joined us today, I'd like you to answer these questions. You don't have to answer them to me, but you can answer them to yourself. Are you looking to find more clinicians or physicians who are interested in your new product or service? Are you looking to create more awareness about your new product or service? Number 3, are you looking to offer unique or specialized services not provided by other healthcare organizations or companies? So you want to stand out in the marketplace. And are you looking to provide an easy way for the patients to identify the clinicians or physicians who use your new product or service, and that way help close the cycle? So, as you know, we are partnering with BodyOne to bring you this clinician or physician finder tool and to help to make the launch of your new product or service more successful. So here is our website if you'd like to learn more about us, but I'm going to turn it over to the team today. But first I'll do an introduction and give you an overview of the talk before I turn it over to our speakers. So if there's anyone who's not on mute, if you could put yourself on mute just so we don't have any background noise, that would be great. So the talk today is increasingly health consumers are seeking expert clinicians who are trained in special procedures, those who offer unique services or are affiliated with a particular organization. Correspondingly, clinicians seek to connect with consumers who can benefit from the services offered at their clinic or hospital. Physician Finder is a smart yet simple solution for medical or consumer products companies that are launching a new solution to physicians, or you just want to grow your market and get to more people. The Physician Finder tool allows you to showcase your physicians and their unique abilities, thereby driving more patients to your new service or product. With advanced functionality, Physician Finder allows patients to search your database of physicians and their practices directly from your website. So I'm going to introduce our speakers now. So you know about me or you've already heard from me. Our first speaker today will be Chris Messina. Chris is the CEO of BodyOne, a cloud software technology leader headquartered in Cambridge, Massachusetts, which is just outside of Boston. BodyOne provides online tools, websites, and web platforms for medical marketing and education. BodyOne's mission is to connect people with health information that matters most to them. BodyOne is also a member of IBM's Partner World. Chris holds multiple global technology patents and is an active blogger on social media in medicine as well as on pediatric genetic conditions. He is a graduate of both the Harvard Business School MBA program and Rutgers University. He also was awarded a Rotary Fellowship to study at Sydney University in Australia. Chris currently serves on the boards of the Harvard Medical School affiliated Mount Auburn Hospital, where he is an overseer, and on the board of the 321 Foundation and the Harvard Business School Health Alumni Association. So I'll talk to you about Michelle. Michelle Alfords is the content and social media manager at BodyOne. She's been using the internet to connect providers with consumers since she built her first website 15 years ago. Michelle works in all aspects of web development and publishing, including writing, design, and marketing. She's produced podcasts, videos, and blogs, as well as written and edited content for traditional publishers. By staying abreast of current trends, Michelle is able to help companies find the best ways to communicate with their target markets. Michelle received her master's degree in publishing and writing from Emerson College. So with no further ado, I'm going to turn it over to our speakers, but I will tell you two things. One is that if you have any questions during the presentation, please put your questions into the chat box and I will ask those questions of our speakers at the end. And the second thing is at the end of the presentation, there will also be a survey that will just take you 2 minutes to fill out, but we'd love to get your feedback on the presentations and what you'd like to see in future presentations. So with no further ado, I will turn it over to Chris Messina. Chris, for you.
Don, thank you, and thanks so much for this introduction. This is truly an exciting and important topic, obviously given the importance of healthcare to us all. And so our objective in this session is to answer the critical question, why? So why should health organizations serve as intermediaries connecting qualified patients with trained clinicians? There's 4 main reasons. The first is to increase utilization of your most effective leading-edge medical services and technology by facilitating appropriate patient demand. The second is to support your trained clinicians and best clinics by flowing business to them in the form of qualified patients. The third is to leverage analytics to get a real-time understanding of both patient demand and physician and market dynamics. And the fourth, and really important these times, is to reduce overall healthcare costs by connecting the right patients at the right time with the right clinicians, products, and services. Now, we're going to share with you a case study on a leading cosmetic procedures company. Now, this company was seeking a way to increase the utilization of their novel, non-invasive procedure for treating scarring. They knew they had a substantial number of potential patients in the US, Canada, and Europe where they had approvals and which were their target markets. And they knew that these patients had not heard about their procedure. And so what they decided to do is couple clinical training to build a base of trained clinicians with a direct-to-patient awareness campaign. So as the clinicians were trained, they began to seek qualified patients to justify their educational investment. Simultaneously, the direct-to-patient program, which was basically a combination of web and social media, increased awareness, and patients began seeking qualified local physicians for training. So at this point, the cosmetic surgery company, which by the way was publicly traded, had a dilemma: how to connect the patients with trained clinicians in their local area. And that's where deploying an advanced physician finder system came in. So first they looked at the existing tools and they saw they were pretty limited. They were broad, they were general, they had no advanced data analytics built in, they weren't integrated with mobile, they weren't local, they weren't personal, and they weren't social. So they decided that they needed to look for a more advanced system. And Body One system met their needs. Why did it meet their needs? Well, first, it's global. It covers pretty much every country in the world, but at the same time, it's also local and mobile and personal. By personal, it's social with advanced sharing capabilities designed into every clinical listing, which doctors, physicians, and clinicians are demanding. It's global in that it integrates maps and driving directions for every part of the world, which is often difficult and often limiting as companies expand their global reach. And last, it's mobile in that it leverages it's fully integrated with smartphones, so it's leveraging all the capabilities such as push-to-call geolocation maps so that it connect the patient with the best clinician right in their local town, whether it's South Dakota, Saskatchewan, Sicily, or somewhere in between. And the last thing is, because this system is cloud-based, it leverages the big data capabilities. And one frustration that many medical marketing executives, business unit executives, health plan leaders have is they don't really know their data, the data in depth on the clinicians, and even with online tools. So we've been in meetings where key opinion leading physician asks the executives of the partner companies that, how can you help me understand and grow my business? So we built in global analytics, and these are reported regularly on an predefined electronic schedule to the physician for their practices. So once a month, which is typically the schematic that most subscribe to, they get an update on all the patient traffic, where it came from, what it was like to their practice. But at the same time, the company or the plan can also get broad overview that can be drilled down right to the granular level to see how much traffic a particular physician's getting or a particular territory. And last, I'll say this system is dynamic, and since it's cloud-based, it's continuously improving. So to summarize the 5 main attributes of the Physician Finder developed by BodyOne, it's social, local, global, mobile, and analytical. So let's return to that cosmetic firm. So what happened with them? So this system was deployed across all the digital direct-to-patient properties because it could be literally plugged into all of them wherever they were, including online ads, the multiple different websites, and it all fed the patient traffic to this single integrated clinician database. Simultaneously, all these clinicians was uploaded with their languages, locations, certifications, all their characteristics to the Physician Finder system. So within hours, the Physician Finder system was connecting qualified patients seeking scar treatment with trained clinicians. And some of the physicians received over 1,000 patient leads a year each. And then each month, the clinicians and company management were receiving reports on patient traffic in granular detail, which further helped to refine the marketing program. Now, what did that do for the business? So this company's scar treatment business grew an estimated 25% a year. And it was led by the 10% plus annual recruitment of clinicians for training. This success then led to a product line expansion, and then the success of this business became a major element in the firm's subsequent acquisition and buyout by a larger competitor. So at this point, so just to conclude, by properly matching the patient with the physician, it led to significant business success. So at this point, what I'm going to do is, you might be wondering, well, how does this all work? What are the details? So I'm going to turn this over to Michelle Alford, who's managing this product, and she's going to share in some detail how it works. And I, Michelle, Dawn, look forward to any of your questions, and I can see that some have already come in. Thank you.
Thank you, Chris. There are 3 questions that Chris asked and that you should be asking yourself. I'm going to touch on each of these and then show how the Physician Finder system addresses them. So first question is, why do patients matter? How does helping doctors help you? And why should you want a doctor locator at all? So why do patients matter? If you're in this webinar, I'm sure you already know this, but a lot of healthcare companies that sell directly to doctors leave patients out of the sales strategy. They think that patients will go to their primary physician or recommended specialist and leave all treatment options up to them. But today's patients are educated and discerning when it comes to picking their treatments and doctors. Here are some numbers that may interest you. 3 years ago, in 2012, 59% of adults looked for health information online. Last year, 62% of adults looked for health information just on their smartphones. And 30% of adults consulted online reviews and rankings of healthcare services or treatments prior to making any decisions about their treatment. Patients use online reviews and rankings of healthcare services of doctors and which treatments to consider. They want quick, easy information that can point them in the right direction. And you want to make sure that the information they're finding points them towards your products and your doctors. So how does helping doctors help you? Doctors are always looking for new patients, but don't want to spend extra time, money, and energy on finding them. Whether you're launching a new product or trying to sell an older product, doctors want to know that buying this product is going to separate them from their competition and bring them new patients. If you can give your doctors solid numbers that show how many patients come to them from your site because of your treatment, or how many patients are going to other doctors in your network, then they are more likely to buy or recommend your product. So why should your website have a doctor finder? Embedding a doctor finder on your site is the perfect way to help both your doctors and your patients at the same time. Patients looking for medical information online can find it on your site, and doctors will get the benefit of new patients coming to them through your site. Now, what makes the Physician Finder system different? The Physician Finder is the most robust doctor locator on the market today. It has advanced search technology, customizable modules, and in-depth analytics. But it's also extremely easy to add and update to any site. Instead of weeks of programming or hundreds of pages, embedding the Physician Finder on your site only takes an hour of setup on our end and 3 lines of code. These 3 lines of code work just as well on a template WordPress design or a complicated customized site that was built from scratch. There are several benefits to using the iframe code. It only adds 1 page to your site, meaning that it's quick and easy for you to add. You just copy and paste the code and put it on the page that you want it on. Other than adding those 3 lines of code to that page, no programming is required by your team. The Physician Finder system is hosted on our servers, not yours, so it doesn't put any weight on your servers, and we are able to optimize it to make it run as quickly as possible. And all future functionality updates are made by us without any additional work being done by your team. This means you always have the latest version of the Finder with the newest tools and capability, and you don't need to lift a finger. The iframe looks like this and will easily fit on any web page, even if there's a sidebar or narrow content area. We also have a widescreen version for those with full screen sites and no sidebars. Many elements are fully customizable, including which countries are included, fonts, colors, and the advanced search fields. It includes a postal search, code search with options for the nearest 5 practices or all practices within 10 miles, an advanced search that can allow users to search by any criteria that matters to them. And again, this is fully customizable, so if you have specific things you want users to be able to search by, we can add that, or we can remove things that you don't think are important. It has maps for if they want to look up practices by specific states or territories. And the Physician Finder system is fully international. We currently support over 20 countries and are constantly expanding. There are also search results pages integrated with Google Maps and individual physician and practice pages, all accessed without the patient ever leaving your website. So what does the Physician Finder system do for you? It gives your doctors a place to show off their credentials. It drives patient traffic to your site. It sends patients to the doctors that buy your products or recommend your products. It has in-depth analytics that can be used to further your sales efforts, and it has an easy user interface for adding and updating doctor data. So let's go into a little more detail on each of these items. First, what kind of information can doctors share through the Physician Finder system? The short answer is anything. Photos, maps, social media, videos, languages spoken, education, health insurance awards, news, articles, etc. Doctors and practices have their own pages in the Physician Finder that are basically miniature websites. If you can imagine information that your doctor or practice might want to share, there is a way for them to share it on the Physician Finder. So how does the Physician Finder drive traffic to your site? The Physician Finder comes with a customizable widget that can be added anywhere that allows code, including sidebars, social media sites, and advertisements. This means that if you have a blog, a partnership with another company, or are running an advertisement campaign, you can include this widget. You can even design your own version of it, as many of our customers have done. As long as it uses the postal code search that we'll provide for you, all searches made through this widget anywhere on the internet will bring patients to their results on your website. The Physician Finder is also extremely search engine friendly. All of those practices and physician pages we discussed earlier are individually indexed. And because they're constantly updated with new information, search engines rank them higher in search results. So whether patients are searching for individual doctors or for types of treatment, your site is more likely to show up in their results. How does the physician finder system increase patient flow to the doctors that buy your products or recommend your product? Here are just a few ways that the physician finder sends traffic to doctors. First, because there are so many more patients coming to your website and searching for doctors from there, each of your doctors is likely to get more traffic. But the physician finder also takes extra steps to connect patients who visit the site of your doctors so that they don't just look at the information and leave. For example, this is one of the optional modules. It's a pop-up that when a patient searches their postal code, they're asked if they would like to be connected by a physician. If they say no, they're immediately taken to their results. If they say yes, they fill in some basic contact information before going to their results. This information is sent to the nearest 5 participating doctors within their search range. This shows doctors that patients are interested in hearing from them, and they can then contact that patient to discuss setting up an appointment. Even if patients skip that step, they can later choose to email doctors directly from the site to set up an appointment. And if the patient doesn't want to immediately contact the physician, they can save the contact information directly to their phone, email contacts, or computer to open at their convenience. This means that whenever they have a few extra minutes, whether it's that day or weeks later, they can easily pull up the contact information for that doctor and call or email them. So what kinds of analytics does the physician finder provide? We track and keep records of every action that patients take on the site. For individual doctors and practices, that means that we can not only tell them how many patients visited their listing, we can also tell them more detailed information, such as how many times they appeared in search, how many emails they should have received, how many times someone clicked on their website link, how many times their contact information was downloaded, and how patients initially found their listing, as well as additional details. We also track overall trends, such as traffic flow and where people are searching from. I know many of our sales reps particularly like the postal search frequency map because it's illustrative. It's an illustrative way to show doctors how many patients are looking for their services in their area. In addition, for many sites, we send doctors or practices an automatic email every month to update them on their listing analytics. Many of the same details in the admin portal are included in this email. Sales reps can be CC'd on this email if they've attached doctors to their sales profile. So how is the physician information updated? The first thing you should know is that it's not actually necessary for you to do anything. The physician finder is fully integrated with customer relationship management or CRM systems, such as Oracle, Salesforce.com, and SAP. So if your company uses any of those, we can use them to automatically update all physician and practice information. You can also send us an Excel or CSV file with all new and updated information for us to upload. If you do want to manage the information yourself, the Finder includes a password-protected interface that allows your team to create and edit listings and view stats for their existing listings. You can give as many or as few people access to this as you'd like. Some of our customers choose to have only 1 or 2 administrators, while others choose to have sales reps, sales managers, and doctors all manage their own information. So this is the admin dashboard. As you can see, you can edit listings, add listings, and view analytics straight from the dashboard. Administrators can also approve changes made by sales reps or doctors, manage user accounts, and customize elements of the Finder. The listing interface is intuitive and easy to use. You can see on this page, you can edit a practice's information. You can fill in the contact information, upload photos or videos, add physicians and insurance, and select office hours. There's a similar page for adding and editing physician information. In addition, listings can easily be made inactive if a doctor or practice no longer fulfills the criteria to be listed, and then reactivated at a later date. This saves you from ever deleting a doctor that you then want to refill out the information. In summary, the Physician Finder is a valuable tool that is simple to maintain and provides your physicians with a personalized website while driving traffic to your site. It has detailed analytics that show its value to both your sales team and your customers. There's a minimal learning curve for setting up and maintaining a Physician Finder, and we provide all customers with basic training. If there are any questions, as Chris said earlier, just ask them in the sidebar and we will answer them soon.
Great. Well, thank you so much, Michelle, and to Chris. Fabulous job there. I guess let me start to turn to the questions that have been coming in. First, I will put this slide up to say if you'd like to learn more about the Physician Finder, you can contact me directly at Health Connections, and I can help make sure we can get you the information you need to put together, what's right for your opportunity to connect physicians and patients. We've also just put up the survey into the chat box, so if you could click on that survey before the session ends, and then you could just fill it out real quickly for us, that would be fabulous. So let me turn to some of the questions here, and I'm going to turn them over, or ask the questions of both Chris or Michelle, and you guys can decide. You can fight over who's going to answer the questions. So here's the first question. Can you customize the Physician Finder's data based on what information we use, like in my company? So if I have information that you don't normally collect or utilize or show in the Physician Finder, can you customize Physician Finder for my particular information? I think that's the gist of the question.
Absolutely everything on the Physician Finder is, data, what kind of data, colors, et cetera, is customizable. So if you have additional fields that we don't currently include, or if you want to remove fields, we actually have a place in the content management system where you can choose to have fields active or inactive, and we're also happy to add additional fields for you.
Great, thanks, Michelle. Anything that you wanted to add there, Chris?
I think Michelle covered it. Yeah, it's fully customizable, and just as healthcare is really, is individualized, even if it's served on a mass basis. So we appreciate that, and therefore have made it fully customizable.
Great, excellent. So here's a question: are you interested in the African market? What would be the technicalities?
So I can take that. Of course, we're interested in the African market. And in fact, one of the neat things about the African market is because it is largely going straight to mobile, and I've written a blog piece about this. It's really leveraging some very advanced mobile technology. And so that's where the fact that we designed the system to be really fully integrated with mobile works very well for African countries. And we have most, if not all, the maps for the African countries included. So yes, absolutely. We have the capability to work in Africa, and we think Africa is a great place, and healthcare there is booming, and in many ways is really leveraging new technologies such as mobile that are coming out.
Great, thanks, Chris. So here's another question: do physicians need to sign on to Physician Finder before being included in the database?
So I can take a first stab at that. Michelle, you can add whatever you want. So the finders that we've been deploying have all been on behalf of either companies or medical device companies or health plans or some kind of a provider group, and they have criteria by which they decide on whether or not to add physicians. And so in that case, for a physician to be added, you'd have to go through the criteria of that plan or that or that company's training process. There are, I guess, a few finders that we've deployed by specific condition areas where a physician who does work in that field can request to be added and join themselves, and those are in a couple of orthopedic and cosmetic surgery spaces. Michelle?
Yeah, I think that Chris basically covered it. I will add that in terms of administrative managing your own data, some of our customers do allow physicians to edit their own data, which is a good process for doctors that really want to make their listing stand out and add pictures and update regularly their hours and that kind of information. So if the physician wants to edit their own data, they do need to have a sign-in information that will only let them see their own data and only edit that data. But otherwise, the physician doesn't need to sign in to be included.
Great, thanks guys. So I'm getting the gist from the questions that there's kind of multiple ways that people are looking at this. So one is, I'm a company, I already, I've started to train my doctors, and I have 100 doctors who are trained to use my product, and now I want to list them as, let's call them certified or approved, or knowledgeable or educated in offering my product or service or technology out to the marketplace. The other thing that I think people are also thinking about is that maybe they don't have a list of doctors, or they want to get more doctors involved, or they want to perhaps reach out to doctors and offer training to doctors. So the question is around sort of like, I know that we at Health Connections have a database of physicians, and I know that you, Chris, at Body One have a database of physicians. So the question is really more about how would a private company access the list of physicians? So I'll answer it first and say we could definitely look at putting that together as part of a proposal that we would offer to you guys if you needed to increase your list of physicians, and or we could also put together an effort to help recruit more doctors to your offering and to your company, and to knowing more about what you have, and then utilize the physician finder to promote those doctors back out to patients, et cetera. So that would be my first shot at answering it. Chris, do you want to take a shot at answering that as well?
Sure. What I would say is that we would work with you to make sure that the data was really clean, because that's a huge problem with all physician databases that are not developed internally but acquired, and so we have a lot of software scrubbing tools that manage that, and so we would just work together with Dawn's company on addressing that.
Great, thanks. And so the other question that's here is, how is the database updated? So Chris just sort of answered how we make sure that if it's our database or we're helping you build a new database, that it's updated. And then I think Michelle answered before how, either you as the company offering the physician finder, you could go in and you could update physician information, or you could send them a spreadsheet or send us a spreadsheet, or you could have the physician update their own data in real time. So did I miss anything, guys, on how is the database updated?
Not at our end.
Okay, great.
I will add that we are adding some additional functionality to have other types of data that's not necessarily the physician data, but such as having all of the insurance data, so that kind of information is readily available, and to provide that so that helps people to update and keep information up to date.
Great, excellent. Thank you for that. So just to remind everyone to go to the chat box and look at the survey, but I have a bunch more questions that have come in. Can the physician finder be redesigned to match our website?
Yes, as I said, there's a lot of customization. I mean, there are some things that it has to be in the iframe, it has to fit within basic guidelines in order for the functionality to work well and for it to be easy for patients to use. But in terms of colors, fonts, things to customize it to better match your specific website, any of that can be customizable.
Great, thank you. So what are some of the existing customer applications that utilize your Physician Finder?
Oh, yeah, that's a great question. So it's really been a broad gamut. I've mentioned some. I mentioned there's been locating dermatologists and plastic surgeons for scar removal. That was a case that I shared in the case study. Another's been finding vascular surgeons and interventional radiologists for treating venous disease. Another's been in locating cancer treatment specialists. Another has been in matching people with orthopedic joint conditions with the surgeons specializing in that. So the applications are really quite broad.
Yeah, the other thing that I know some people are talking to us about right now, it would be more, actually even from the government perspective. So the government often offers, different programs. Let's say it was, screening for some medical condition or, vaccination or something like that. So if the government is sponsoring something, they want to let people know, again, easy ways to find the people who are offering that service. So that's another great application of it that I'm seeing more and more people talk about, which is good. Okay, here's another question. If we want to implement this Physician Finder, how long will it take to set up?
Oh, okay, sure. So thanks for that question. So since this is designed to basically plug directly and seamlessly into any website or combination of websites and online digital properties, it can be implemented in as little as a week. Some other installations that we've done have required detailed customization and integration into CRM, which is customer relationship management systems, and those can take 2 to 3 months. But the bottom line is that we can really move as fast as the organization, the patients, and the clinicians require.
Okay, super, thank you. Have you seen any legal concerns at all?
Yeah, so that's a great question. In general, physician finders are well established and expected by both consumers and clinicians. But obviously the major concern is around potential inducement, which is, are you giving something valuable to an individual physician in order to induce their business, for which you then turn around and bill Medicare, Medicaid, Health Canada, or other payers? We haven't seen any major concerns from the legal and regulatory departments of our clients, but obviously all new medical education and marketing programs should be cleared by internal legal and regulatory review.
Okay, thanks, Chris, for that. And I'll just do one last call for questions. I have another question to ask, and then I just have a few summary slides, and then I'll ask Chris and Michelle to do a summary as well. So how do you prevent your, from a technological perspective at BodyOne, how do you prevent your Physician Finder from becoming stale as technology evolves?
So that's another great question. So obviously, preventing staleness is important with any new technology. I think read somewhere that the average technology life cycle is 2 years and under. So it's particularly the case. We also manage at BodyOne, we build and manage medical websites, and over half of our clients are coming to us because they had a great website 3-4 years ago and it's now old and tired, and then they have us redo it. That's not an issue with the Finder because we deliberately chose to make it cloud-based, which means it's up on servers in the cloud like Amazon is, or like just a huge number of kind of cutting edge technologies, which means that it can be enhanced continuously in one central location, which is what we're doing, and then instantly updated across hundreds of websites. So that's how we've addressed that.
Great, thanks. Well, there is another question here before I go to the summary. It's to you, Chris, but I think I might half answer it as I pass it over to you.
Sure.
The question is, what would be the conditions of partnership in pioneering this in East Africa and Kenya, specifically where mobile phone usage is at 80%? And my comment would be is, yes, we'd love to talk to you about doing that, but I'll let you answer it more fully, Chris, if you like.
I would just say I'd love to do that. Because I think it's an ideal application we can build, and creating a mobile-only version is easy to do since the technology is there. And as I mentioned, I've actually written and studied about the use of mobile phone technology in Kenya, which is really quite neat what they do. So just digress for share one anecdote, which our questioner probably knows much better than I do. But in Kenya, it's possible using your mobile phone to pay for your medical care, the level of medical care, right with your phone, right at the doctor's clinic. And let's say if you're about to have a baby, if you're a woman, your extended family can send you money via the mobile system and basically fill your account. So then you can, that's kind of a gift to the new child. And then you can use that to pay for your maternal care. It's one of the ways in which Africa is pioneering innovations that I think the rest of the world would do well to look at. So thank you very much for that question.
Great, thanks, Chris. That's a fabulous example. So I'm just going to show a few slides to say, again, if your overall goal is connecting health consumers with physicians, and you would like them to use, they use your product or service, and you'd like to put more of those connections together and make yourself more well-known in the marketplace, then give us a shout and we'll talk to you more about the Physician Finder system. And as we just covered off, it's the opportunity to leverage both online and mobile technology to better connect health consumers with physicians. So I said all these points earlier. Hopefully you feel we've done a good job covering them, helping you find more clinicians or physicians, helping you create more awareness if you're offering a unique specialized service and that you want to connect those patients. So here's my contact information again if you'd like to talk about us putting together a proposal to help you grow your business with the Physician Finder system. And I will then just also turn it right back to Chris and Michelle to let you guys do a final word on what you'd like people to remember about today's presentation. So over to you, Michelle, first.
Thank you, Dawn. I'd just like to say that, we're happy to talk with you about the specifics that you are interested in the Physician Finder for, because as I said, it is very customizable and it can be used for a lot of different applications. So if you didn't see specifically what you were looking for in today's presentation, odds are we can still help you out. So let us know if you want to have a conversation.
Great, thanks, Michelle. And over to you, Chris. You have to just unmute yourself, Chris.
Sorry about that.
There you go.
Yeah, I was talking to myself there for 30 seconds. I would say with any new technology in healthcare, it has to do two things. One is it has to improve patient care by making the physician's life easier and the patient's life easier. And the second thing is for businesses and plans that deploy this, it has to make business sense. And so when we develop this system, we put those three conditions in front of us, that it has to make life easier for the patient, it has to let the physician leverage their time, and it has to grow business and achieve a bottom line ROI. And so I shared this story about the company whose scar treatment business grew 25% globally, and their clinician recruitment increased over 10%. Those are the kind of results that we hope and expect from this physician finder system, and we'd be delighted to work with any of the many people around the world who've been on this webinar today. And last I'll say is thanks for your interest and attention and all the great questions.
Yes, thank you everyone for your participation today. And just one more reminder to please fill out our short survey there in the chat box. If you could just go there, that would be great. And thanks again to Michelle and Chris, who have worked tirelessly to continuously improve the physician finder system. And I'd love to have a chance to chat with all of you about how we can help you be more successful. Thanks everyone, have a great day, and we'll talk to you soon. Bye now.
Thank you, bye.
Take care, bye now.